Hello everybody, welcome back to my channel. In today's video, I am going to share with you guys my presentation on the importance of nursing and informatic in anesthesia. So most of the time when we hear about anesthesia, we always think of the bedside patient care. Let's get this patient to the OR, let's intubate, da 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 da. But we often forget that behind the scene, we need informatics because it helps us evaluate the care that we offer to this patient. It helps us also understand the policies and practice, the research. So informatic is something that all providers, not just anesthesia providers, should understand and incorporate in their daily practice. So, guys, this is my project. So, it's gotta be more formal than my previous video. And hopefully at the end of this presentation everybody understand how important nursing informatic is, not only for anesthesia but all the practice. So let's start. So, healthcare informatics is among the innovative drive in healthcare technology, which is transforming anesthesia practice by enhancing safety, ensuring proper data management, and efficiency of workflow. So here the presentation aimed to identify and to evaluate critical aspects of healthcare informatics as widely used in anesthesia practice. We're going to talk about five major concepts on standards and regulation, legal and ethical issues, patient safety, security and privacy, and workflow process. These concepts are more likely to be used by healthcare informatics. So, furthermore, we're even going to seek to underscore the need of informatics within healthcare practices to ensure efficient healthcare delivery within the current clinical setting. So it is crucial that anesthesia provider understand that managing data, ensuring safety, and enhancing efficacy must be accompanied by healthcare informatics. Evaluate key issue in healthcare informatics within anesthesia is done by healthcare informatics. Informatics significantly enhance patient anesthesia practice by improving the safety, the efficiency, and data management. So let's talk about the standards and regulation. Healthcare informatics is a broad concept, like you all know, which is influenced by various standards and regulation procedures, which are designed to ensure there is the effective and safe use of technology in nurse anesthesia practice. The two major standard and regulation acts are the Health Informatic Technology for Economic and Clinical Health, also called the High-Tech Act, and the Health Insurance Portability and Accountability Act, which is also called HIPAA. The High-Tech Act was enacted in 2009, which over the years has represented the landmark in the transformation of digital health within the healthcare system in the United States. HIPAA, on the other hand, was enacted in 1996 with the main focus of safeguarding security and privacy in providing health information. Its main mandate is to ensure that all EHR are secure to protect the confidentiality of patient, of course, which directly affect how nurse anesthetic examine and document patient information. So the High Tech Act encourages the adoption of the EHR in the provision of financial incentive while enforcing non-compliance policies, thus enhancing the integration of technology in nursing practice. Another regulation which has been crucial over the years is the implementation of the International Organization of Standardization, the ISO standards, which assesses the risk management practices in information technology network under medical devices. The standard indicates that the integration of devices such as monitoring system or anesthesia machines does not contribute to patient safety. For example, the ISO standard 80001 require a throughout assessment of risk and protocol establishments in managing potential risk, which ensures that the interoperability of the health IT system and medical devices, which may not lead to any adverse effect. So these regulations within nursing practices formulate meticulous compliance in safeguarding patient information and ensuring quality health care. For example, adhering to the HIPAA Act indicate that anesthesia providers should utilize encrypted channels for communication and ensure that there is authenticity in EHR system permitted to only authorized personnel. This protects the privacy of patients and offers trust and compliance within the entire healthcare system. So therefore, the use of all these regulations plays an important role in defining the practices under nursing anesthesia while enhancing the improvement of patient outcome within the healthcare delivery system. So the next point is legal and ethical issue. Several and ethical challenges within healthcare informatics affect nurse anesthesia practices, which raises concerns about data ownership, consent of patients, and informatics errors. A major challenge in the legal and ethical framework is obtaining and maintaining informed consent within the digital age. So providers in anesthesia practice ensure that patients use and understand the use of EHR for the usage and protection of their health data. This approach utilizes transparent communication of the purpose of data and security measures used in data protection, which in turn maintain patient trust and adherence to patient legal requirements. Moreover, complexity in the use of digital consent form may lead to underscoring concise and clear information about patients. So the ownership of data has also become another legal and ethical issue in nursing informatics within anesthesia practices. From the traditional point of view, health record were in the possession of healthcare provider rather than patient. However, the advanced use of EHR has shifted the dynamic of traditional practice. In the current world, patients have asserted themselves in their rights and access to controlling health information as EHRs has been supported by different regulations such as HIPAA and the GDPR. This approach requires the use of data management practice in navigating and balancing patient information and facilitating the accessibility of authorized individuals. Adherence to these legal frameworks is crucial in ensuring that information is protected and available during the patient care. Lastly, informatics errors are another legal and ethical challenge, especially when precision is paramount. Various errors in EHR may result in incorrect dosage, missed allergy, and adverse drug reactions. These approaches may result in severe patient harm. Other legal implications such as error may result in malpractice lawsuit in different disciplinary actions. Therefore, nurse anesthetic ensure the reliability and accuracy of the information which is clearly used in decision making. Now let's talk about patient safety side. So we have tools and systems in healthcare informatics that influence patient safety, which has numerous benefits and challenges. These various informatics systems, such as the Clinical Decision Support System, the CDSS, and the Computerized Physician Order Entry, the CPOE, that have enhanced patient safety by ensuring the safety of patient data, thus minimizing errors and enhancing better decision-making process. For example, EHRs ensures that anesthesia provider access patient information and history quickly and it is in an effective manner, thus ensuring the patient have access to the necessary information before anesthesia administration. This approach minimizes adverse reactions and enhances patient outcomes. Various studies shows that there are positive effects of informatics tools to enhance patient safety. Implementing the CPOE system in anesthesia practice minimizes medication errors and incidences, ensuring that orders are complete and clear against any drug interactions. According to the research found out to the research on my I listed the reference, my first reference. That research found that the use of CPOE system minimized medication error by up to 55% within their surgical settings. And moreover, the CDS is another informatics tool that anesthesia providers commonly use in offering reminders and real-time alerts on any potential issues and best practices. This enhances quality and safety in healthcare delivery. However, there are various challenges despite the benefit of healthcare informatics in nurse anesthesia. Reliability may vary depending on the entries of the data while enhancing consistent use by healthcare providers. So these errors made due to multi-system malfunction and data entry errors may provide misinformation and potential harm. So we still have to be careful. Thus, there is a huge gap in the need for quality assurance and training approaches to ensure that systems are safe and used effectively. The integration of healthcare informatics within anesthesia practice entails a positive impact on patient safety, which minimizes errors and improves the patient outcome. Let's talk about security and privacy. So the data security and privacy are important aspects of healthcare informatics, especially when information about the patient should be protected in nursing anesthesia. There may be significant harm, especially when the need for data security cannot be overstated. These instances include financial losses, identity theft, and damaging the trust of patients. Detailed records of patients within anesthesia practice are important for safe practices. Therefore, compromising information may have dire consequences for both parties. Nurses should ensure that patient data information are safe and secure, which is important in maintaining the integrity of healthcare practices. The various approaches to ensure the patient information is protected effectively adopt several strategies. One of the strategies used to incorporate this approach is the encryption of data that ensures intercepted information remain unusable and unreadable to any unauthorized party. A comprehensive protection approach should be utilized for stored and transmitted data. Robust access controls are important where only authorized personnel have access to sensitive information of patients. This approach is achievable through the use of multi-factor authentication to minimize any unauthorized access. Monitoring and regular audit of access log an important aspect for ensuring data security is highly maintained. The practice ensure that backlog user can easily identify and attend to any suspicious activity while ensuring that there are no breaches that remain unaddressed. It is necessary to monitor user with access to patient record where unusual activity may indicate a security challenge. Moreover, healthcare providers should be trained and well informed on the need for data security and privacy, especially when dealing with crucial patient information. They should be well versed in handling patient information while responding to security issues and any phishing attempts. Lastly, another important aspect is ensuring that software and systems have updated security patches. The software which is outdated and is vulnerable to threat to attack, which makes maintenance and updates a necessary aspect to enhance a robust security strategy. Moreover, implementing security measures ensures that firewalls and detection systems are protected against external threat. This approach will improve patient safety and privacy within anesthesia practice. Now let's talk about the workflow system, and this is going to be our fifth point that we're supposed to talk about. And after that, we're going to get engaged into a little discussion and the conclusion. So the workflow process. The use of informatics system within anesthesia practice influences the processes within the workflow, thus offering challenges and benefits. Nursing informatics tools provide a streamlined workflow through centralizing and automating data management systems. The tool ensure quick access to patient information, therefore ensuring anesthesia provider retrieve a comprehensive medical history from previous anesthesia record and medication list. The ease of access minimizes the time spent on manual retrieval and data entry, which allows provider to focus more on patient care and have a critical decision-making process during perioperative periods. One major advantage of informatics system is enhancing workflow within anesthesia practice is improved communication and coordination among healthcare systems. Anesthesia informatics system management, also called AIMS, provide platform for surgeon, anesthesiologists, and healthcare professionals where they can share information in real time. This approach ensures that all members of the team are updated with the status of the patient, which minimizes miscommunication, risks, and errors. For instance, an anesthesia provider during surgery may provide a quick update on the medication administration and signs of the patient, which the entire team may use to provide accurate responses. However, there are various challenges which may disrupt the workflow while integrating informatics tools. Nursing anesthesia provider may require training, programs, and learning workshops to be proficient in the new system. During this period of learning, the efficiency of workflow may decline temporarily. Over reliance on electronic systems may sometimes raise technical issues and software breakdowns. So this may result in unavailability of patient data, which affects or compromising patient safety and workflow. Therefore, there should be a robust contingency plan used for data entry, which may affect mitigating this risk. So now let's open the discussion to the future direction. So healthcare informatics within anesthesia practice has enhanced the precision, efficiency, and safety of peri-op care. One of the major impacts of healthcare informatics is the accessibility and accuracy of patient information through the electronic health record. Healthcare provider access history and medication lists for patients, which are important in making informed decisions on the management of anesthesia. For example, an anesthesia can examine any adverse reaction in patients, which may assist provider in tailoring any plans to avoid any complications. The comprehensiveness and immediacy of information through the electronic health record may minimize any error and ensure quality health care. It is evident from different studies that efficacy of healthcare informatics improves patient outcome in anesthesia practice. Clinical decision support system also assists anesthesia providers with real-time alerts and guidance on any drug, contraindications, and interactions. This approach ensures that nurse anesthetic have real-time information and update with the clinical guideline and measure that provides quality and patient care safety. Additionally, there is an optimized workflow process that enhances the integrity and standardization of information while supporting the clinical decision making progress. Anesthetic can easily access the relevant information, which aid in the critical choices during the patient care. All advanced technology measures such as checklists and airway management systems have minimized surgical complication in OR. There are various innovations in airway management such as advanced supraglottic airways device and video laryngoscopy which protect patients from harm. Other advanced system technology which have enhanced period patient care include bedside ultrasound, electroencephalographic depth of anesthesia monitoring like the BEAST monitor, and advanced neuromuscular transmission monitoring system, which have remained satisfactory over the years. All thanks to informatics. Therefore, there is a positive impact of adopting nursing informatics within nursing anesthesia practices. So, in conclusion, healthcare informatics plays a vital role in advancing anesthesia practice through enhancing patient safety, ensuring proper management of patient data, and improving the efficiency of work. Various regulations using healthcare informatics, such as HIPAA, HITECH, ensure that patient data is secure and ethical for use. There are other informatic tools such as the CPOE, the Clinical Decision Support System, the electronic healthcare record, which minimize error risks and improve decision making. The integration of the system foster and enhance communication setting among healthcare teams, which contributes to effective and more coordinated patient care. However, several challenges require potential and rigorous training activities to address technical issues. Future research should focus on enhanced optimization of the usability of informatics system, developing a robust plan for mitigating technical disruption may minimize errors and risks that occur due to technical disruptions. The strategic implementation of healthcare informatics contributes to enhanced improvement of patient outcome within delivery of healthcare system. So, and these are my references. I hope this was really, really educative that you guys understood the place of nurse informatic into anesthesia care and all the healthcare system. Thank you and put a like and comment down below. Thanks.